In this lecture, we're going to continue to look at the familial risks for abuse. Last time we talked about parent management skills and some other things like the family structure and how that might affect or increase the risk of abuse in children. Today we're going to continue that discussion, and we're going to start by looking at how parental mental health or intellectual disabilities might affect the ability to parent. Now, there is not a lot of research on these topics, but what little we know suggests that parents who have mental disorders or serious mental illness are at increased risk for maltreatment. The first one I'd like to take a look at or discuss is schizophrenia. We know schizophrenia when schizophrenia is kind of episodic. It comes and goes, and sometimes the symptoms are very florid and sometimes they're kind of in abatement. One study that was looked at schizophrenic or mothers with mental illness, they looked at more than 4,000 4,000 mothers in Philadelphia in 1995 to 2000 who had some major mental illness. And they used Medicaid records to identify women with major mental illness. And what they found was that mothers with serious mental illness were 3 times more likely to have come into attention to child welfare or to have lost custody of their kids. So this suggests that moms with a major mental illness could be at increased risk. So let's talk specifically about schizophrenia. Traditionally, people with schizophrenia had very low fertility rates. That's because historically they were institutionalized. There were little opportunities for them to meet someone and have children. But that's not true today. And so let's take a look at schizophrenia and what the problems might be with regard to parenting. What I'd like to share with you is a chart that shows a study that looked at 38 women, and that's a small number, 38 women who were inpatients in a psychiatric mother-baby unit. Okay, so they went into an institution with their children. What they did was the mothers either had schizophrenia, bipolar disorder, or major depression. So all 3 groups are disturbed. And they were videotaped while they were interacting with their infants. Later on, blind coders coded the mom's behaviors on a number of different dimensions. And so what I'm going to share with you now is the results of the study. By the way, raters were asked to rate each dimension in terms of 1 being the poorest behavior and 5 being great behavior in each dimension. So let's take a look at that. Okay, it's a very busy chart, so let me break it apart. Across the bottom you see the different dimensions: warmth, acceptance, responsiveness, sensitivity, so forth and so on. Okay, and then these different colors indicate the different types of diagnoses. What you can see right off the bat is on virtually all dimensions, the schizophrenic moms were performing more poorly as compared to the bipolar and depressed moms. Now, what's absolutely missing from this study is a group of normal or moms with no mental illness, so that we could even compare how these guys compare to moms without a major mental illness. But I think the important thing to note is that the schizophrenic moms were having particular difficulty. And what the raters noticed is that the schizophrenic moms had difficulty understanding or being sensitive to the needs of their children. So think about being a parent or even seeing a baby and holding your friend's baby or your sister's baby. One of the first things that happens is that, as you interact with a baby, you have to be very responsive to how they accept your interaction. If they like what you're doing, they might smile and gurgle and bubble. But if they don't if they're bothered by it, they'll turn their gaze away from you, or eventually they'll start crying. What they found in this particular study was that moms were very insensitive to the cues that their children were giving. So they didn't respond well to infant cues. And as you can see, they were much lower on some very important parts of this mother-infant interaction. See the non-intrusive behavior? This means being able to recognize when your baby's pulling away and to pull back yourself. So the schizophrenic moms were showing some particular difficulties. Now, I wish I could tell you more about schizophrenic moms, but it's so hard to find any research on this. But suffice it to say, they have problems. Let's take a look at another major mental illness, and one that there is much more research on, and that's depression. We've had lots of studies that have looked at maternal depression and childcare. And as you might expect, neglect is a huge issue with depressed moms, because depression in and of itself is an internalizing disorder. People who are experiencing a severe depression have an inability to basically take care of themselves, much less take care of children. Interestingly, though, studies have shown that it's not just that depressed moms are more neglecting, they're also more hostile. Okay, and if you think about it, if you're depressed, one of the things we know is that kids are not easy to take care of. They demand attention, they need attention, they want attention, and if you're unable to deal with it, you might strike out. So, for example, one study showed that depressed moms were more likely to use harsh parenting strategies. You just want them to calm down, and maybe you just lash out at them rather than reason with them in a way that you might when you're not experiencing depression. Depressed moms were more likely to have disorganized household management, and then often withdrew altogether, which again relates to neglect as a definite problem. We also know that children who are growing up in households with a depressed mom show a variety of problems, from depression themselves to hyperactivity, internalizing and externalizing behavior, just like children who have experienced other types of maltreatment. So in sum, what we see is that depressed moms are at risk for a variety of poor parenting strategies, perhaps neglect, perhaps physical abuse, and their kids show the same kinds of outcomes that you see from kids who have experienced other kinds of maltreatment. So it's certainly something that's very important to look at. Substance abuse. What can we say about substance abuse? Substance abuse is the most significant problem that you'll hear from any caseworker that works within child protection. In fact, 80 to upwards of 90% of people who are reported to Child Protective Services have some kind of substance abuse problem. Caseworkers will talk about meth, or they'll talk about the opioid epidemic, but one of the most common types of substance abuse problems that you see with substance abusing parents is alcohol. Okay, you may have other problems as well, meth, opioid, but alcohol is sort of the standard fare that you see. And as you might guess, substance abuse is more associated with neglect. Parents who have substance abuse problems tend to go on benders, where they're neglecting their child, or they pass out and they're not taking care of their kids, and so forth and so on. In a study that was done about 10 years ago, each state was asked to relate what is your number one problem in the state leading to maltreatment. And what you saw in that particular survey is the number one answer by 85% of the states was substance abuse. So you see it's a significant problem. It cuts across the U.S. We also know that 2/3 of child fatalities in this country have substance abuse associated with. So substance abuse is a huge risk factor in abuse. Finally, I'd like to talk a little bit about intellectual disabilities. It's not a mental illness, but rather it's a developmental disability. There are very few studies looking at parents with low IQ who have an intellectual disability. And most of the information that we have is pretty anecdotal. You talk to caseworkers, any kind of service provider, and what they'll usually tell you is that these families need a lot of assistance in parenting. And as you might guess, the more severe the disability, the more assistance parents will need. Again, parents with intellectual disabilities, historically, we didn't talk about that because for the longest time in our country, people with intellectual disabilities were placed in an institution where they lived out their lives. That's not true today. And there are opportunities then to live your life in a more independent way. But one of the consequences, of course, is that we'll have parents who have intellectual disabilities. When I was working as a parent aide for abusive families in upstate New York, close to Syracuse, I worked a lot with parents who had intellectual disabilities. As a parent aide, what tended to happen is if you were successful with a family that had certain characteristics, you tended to get those cases more and more and more. So I ended up with quite a few families who had intellectual disabilities. And the parenting was really varied depending on how high functioning the parent was. One mom that I worked with who was fairly low functioning, but kind of in the moderate low IQ range, all she really needed was some help in understanding how to take care of her daughter properly. And then once she got the hang of it, she did a pretty good job. On the other hand, I had other families where they had severe intellectual disabilities and they had huge problems with neglect and physical abuse. They used physical punitive strategies to discipline their kids. And in the end, this one family that I worked with, literally every single one of their children got taken away one by one. They had the oldest child was taken away, put into foster care, then the next one. Then the mom got pregnant again. They had a baby. She had the baby for perhaps 6 or 8 months, and and that little girl got taken away too. So this was a family that needed a lot of assistance and was having huge problems in their parenting role. Depending on the parent's disability, parents may need help with things like basic nutrition. For example, let me give you an example of this one family that I told you about that was having real problems. I went to visit them one day, and mom had put, this was when her daughter was young. She'd just been born. She was about 3 or 4 months old. And I went to the house, and she had put Coca-Cola in the baby's bottle, and the baby was drinking Coke. So, just that basic level of understanding, basic nutrition that you don't feed a baby soda. They may need help with developmental concepts. At what point is it reasonable to expect a child to be able to be potty trained? If you find a mom that expects, a 12-month-old to start potty training, you're going to have some real problems because the child just won't understand it. And then finally, discipline. Many of the parents that I worked with resorted to physical discipline right off the bat because they didn't know how to manage their kids. And as you might guess, because this also fits with the parent management that I talked about last time, they weren't really good. They didn't understand good parenting skills. So their children did have some pretty significant behavioral problems, which only then exacerbates their problems. So they don't know how to deal with it and they strike out. Most people agree that parents with intellectual disabilities will continue to need assistance throughout the life of the child. So that, like I said, that one mom I worked with that was doing fairly well, when I worked with her and explained to her what her daughter needed and what she needed to do, she grabbed onto it fairly quickly. But don't forget, her daughter will get older. So while her little daughter Gladys was, I think she was about 2 at the time, she now, my parent knows how to deal with a 2-year-old and what to expect. But then later on, the child's going to be 5. What's the issue there? Well, we got to get you to school. What I'm saying is that, as children grow, they're going to have different needs. And for people with intellectual disabilities, they may need support throughout their lives. So there are, like I said, very few studies looking at this. The few that have looked at this definitely show that there are problems. Let me just give you one example. This was a study that was done over a 2-year period in the Boston area. And what they did was they found that they were just looking at substantiated cases of abuse. So these are only reported children. And what they found was 6.3% of the substantiated cases were with families where at least one parent had an intellectual disability. Okay, So when you think about this, what does that mean? You might think, well, 6.3%, that's not too much. But think about the baseline of intellectual disabilities in the population. Remember the normal curve? And what percentage of the population might be eligible for diagnosis? Remember, the IQ has to be, 2 standard deviations below. So what you're talking about is 2.5% of the US population could be diagnosed with an intellectual disability. Because remember, it takes more than just IQ for the diagnosis. But if only 2.5% of the population will necessarily be able to be diagnosed with an intellectual disability, and you see 6.3% in your substantiated cases, that's quite a difference. And it suggests that intellectual disabilities is a big deal. Let me share with you just one study that looked at some parents who had come to the attention of authorities. And this was a study, a follow-up study of parents. And I'm using MR here because that was the term that was used. This is an older study, okay? So what they did was they looked at 64 parents with MR, which is now called intellectual disability. It used to be called mental retardation, okay? And they followed these parents up for 1 to 7 years later. And this graph, which shouldn't have popped up right away, but let me just say that, at follow-up, 1 to 7 years later, you saw that virtually over 80% of the children 1 to 7 years later were not in the care of their parents. Okay? So in other words, they had been removed and not returned, which is pretty significant because in most families, the intention is to get the parents to do better and then to return the children and reunify the family. And you saw that in this particular study, about 18% of the kids who had been reported to Department of Family Services were actually returned to their families. This study also looked at the living situations of the children at follow-up. So they were not in care. Where were they? Okay, and here's the results of that. What you see is a huge chunk of kids, almost 34%, about 34%, the parents had their rights terminated. In other words, the Department of Family Services or Child Protection had determined that the parents would never be able to parent their children. Their rights were terminated, and these children would have been given up for adoption. Only about 11% were with the parent in care at that time. There's a healthy chunk that were in foster care. A certain number of parents who voluntarily relinquished their kids. So those rights would have been terminated as well. As you can see, a vast majority of this sample, the reason why the children are not in care is because they are removed permanently from the household. In this particular study, 2 children had died. One committed suicide at the age of 11, and one was beaten and killed by a boyfriend in the study. And then finally, a little small chunk of children with the non-disabled parents. So sometimes parents, only one parent has an intellectual disability, but one does not. And so what you see in this very small study is that a healthy chunk of these kids are no longer with their parents. Now, the one problem with this study is there's no control group. Really, it would be nice to know, for example, this graph. How does this graph compare to other families without intellectual disabilities who are reported for abuse or neglect? I would guess that these numbers would be very different, but you don't know because in this particular study, they didn't have a comparison or control group, which is a shame. Okay? So we've talked about parents with serious mental illness or having significant developmental disabilities. But let's also talk about some other risk factors that are not within the family. So what I would call extra familial factors. One thing, if you work with families who are abusive or neglectful, what you see is they lack support. if you ask them who they can turn to when they're at their wits' end, they can often not name people that are very supportive of them. They're typically very socially isolated. And parents, even parents who have family members that live around, the quality of the support from family members isn't that great. So for example, it wouldn't be uncommon for, let's say, a family member who lives close to, it wouldn't be uncommon for them to steal from my mom, the mom that I was working with, or something like that. So, even when you have supports, they're very poor supports. So they have fewer friends, fewer contacts, and so forth and so on. And then the last thing that is huge is the effect of poverty. Poverty and maltreatment go hand in hand, and they're highly, highly correlated. So if you look at, for example, the incidence of neglect per 1,000 children, and this is a little bit of an older study, so maybe we'd be talking about under 20,000 or 25,000 today. But you see the incidence of neglect per 1,000 children is huge, and it's highly correlated with income. That's why when we look at research that looks at maltreatment, you have to somehow account for the effects of poverty. If you don't, you have these problems. You might see that the kids are there's a difference between the children here, but you don't know if it's the maltreatment that did it or the poverty. So that's a huge impact. So I'd like to end by describing a study. Okay, we've talked about these risk factors, and I've just talked about this risk factor, that risk factor, blah, 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 blah. You've got them all. This was a study that looked at 644 families. They were part of a larger family sample of families. And this was in the New York State area, okay? And this was a sample of families and kids who were between 1 and 10 years of age in 1975. And what they had was they had assessed the families at various points in time, and then they assessed abuse two ways in 1991. First of all of the kids in 1991 were over 18, and so what they did was they assessed the kids, a self-report of abuse. So retrospectively asking them, what kinds of abuse did you experience? What kinds of abuse did you experience while you were growing up? They also searched the New York records for reports of abuse. So they have both reported and non-reported cases. And they very nicely separated the types of abuse that kids experience into physical abuse, neglect, and sexual abuse. So let me give you an example of risk factors that they looked at. And don't copy these down. It's not really important. But for example, demographic factors like low family income, young mother, having 3 or more kids. They looked at family factors. So these are factors that they would have measured as the children were growing up, aside, separate from abuse. Family conflict, maternal anger, trauma history. They looked at parenting factors like maternal hostility, power assertive punishment, which is the tendency to use physical punishment, unwanted pregnancy. They also looked at factors related to the child, a low IQ, low birth weight, and so on. And then what they did was they took those and tried to figure out which risk factors were most important for each of the types of abuse. And so I'm going to show you a table right from the journal article itself. So here are the risk factors for physical abuse. I don't want you to try to memorize these or worry about these too much, but I just want you to see that for physical abuse, there's a whole list of demographic factors that are important. Things like being a single parent, having a young parent, welfare. Family risk factors, there's also a huge list. Poor marriage quality. See, here's maternal illness. And then parenting risk factors. The only child risk factors are pregnancy or birth complications. Now, why would that be important? Well, babies who suffer from birth complications are often more difficult to care for. And so if you have a parent who has, some of these other risk factors, this becomes also a great risk. Now compare this with a neglect. And you again see this large list, even a larger list than we saw for physical abuse. But what I want you to notice is that so many of the risk factors for physical abuse are also risk factors for neglect. Look, single parent, maternal youth, being on welfare. Of course, being on welfare and being low income are related. You saw some of these same family risk factors, serious maternal illness, poor marital quality. We saw these two factors also in abuse. And then, we saw some slightly different child risk factors. What I just want you to note is that so many of the risks for physical abuse are also risks for neglect. And so knowing something like whether or not it's a single parent doesn't help you figure out whether that's a risk for physical abuse or neglect, but you certainly know it's a risk. Now I want to contrast this with the last type of abuse that they looked at, and that's the risk for sexual abuse. As you can see, the list is much, much smaller, and you don't have some of those same factors that you had in the other ones. Instead, you don't have low income and things like that. Instead, you have a young mom, a parent who died, okay, which sets the child up for risk. The presence of a stepfather in the home is a risk factor because when you have a male in the home who's not related to some of the kids, it breaks down some of those taboos that you have against incest. So just having a stepfather present increases risk. Parental risk factor, the only thing was an unwanted pregnancy. But here, what you see is in the child risk factors, two slightly different ones that didn't show up in the others. And that is the child's gender, so being female puts one at great risk, and also being handicapped. And you can see the effect. This is sort of what's called the odds ratio. This is quite large. So having a handicapped child is probably more vulnerable to someone, taking advantage of them in the household. Okay, so point is then sexual abuse is a different animal here in terms of maltreatment. Finally, what the researchers did was they took the number of risk factors that a child had and then predicted the chances of maltreatment. And this is what they found. Now, what you can easily see is that the more factors that are present, the more likely you are to see abuse. And the real risk comes at having 4 or more risk factors. A child who has 4 or more risk factors is significantly more likely to experience that type of maltreatment than other children. Here, this line is the sexual abuse. You saw that there were not very many factors that predicted sexual abuse, not as compared to the other two. But boy, if you have, 2, 3, and now 4 of those risk factors, the odds of maltreatment just skyrocket. But you see the same pattern in the other types of abuse as well. So having 4 more risk factors then put kids at significantly higher, greater risk. But I want you to think about some of those risk factors. Go back to the other slides. Some of them are highly correlated. So having a mom who's young means that she's probably not very educated, which means she probably doesn't have a high income, which means she probably, and just keep going and going and going. And you can see that the odds of children having 4 or more risk factors can get pretty high for some of these types of risk factors. Okay? So I hope I've given you a sense of the kinds of things that place children at risk. They don't occur in isolation. They each have some kind of unique contribution, but as this study showed, when you start piling on risk factors, you can greatly increase the chances of abuse. Thank you.